Well, good evening, ladies and gentlemen. Is this microphone? Yes, it's working. Thank you. Good evening again, ladies and gentlemen. Before we start, can I please urge you to, if not switch your phones off, please turn down the volume on those phones because you may wish to use them later on during the evening to send Twitter messages to us. Firstly, welcome on behalf of the Save Our Palliative Care Committee to tonight's meeting. If there's one way to perhaps make sure a forum is going to be not so well attended, make the announcement, and there it is. I'd like to right out front, I'd like to congratulate the committee for the work they've done, and we'll get to that a little bit later, but a fantastic job and a fantastic outcome. So on behalf of the committee, I formally welcome you all here tonight, and I formally welcome all the invited guests and dignitaries who've seen fit to attend, and they include Mayor Andrew Lee, Mount Gambier City Council, Mayor Richard Sage, Grant Council, Mayor Erica Vickery, Lucendale Narracourt Council, Mayor Peter Gandolfi, Wattle Range Council, Mr Troy Bell MP, Member for Mount Gambier, Mr Stephen Wade MLC, SA Shadow Minister of Health, Mr Mitch Williams MP, Member for MacKillop, Mr Tony Passon MHR, Federal Member for Barker, our guest speakers, Dr Yvonne McMaster OAM, Ms Jane Downs, Regional Director of SE Health, Dr Mike Broughton, Mrs Margie Carruthers, Mrs Jenny McRae and Ms Tracy Watters. I have a list of apologies for this evening as well, and they include Joe Wetherill MP, Premier of SA, Jack Snelling MP, SA Minister of Health, Jeff Brock MP, Minister for Regional SA, Leader of the Opposition in SA, Stephen Marshall MP, Senator Nick Xenophon, Senator David Fawcett, Senator Fiona Nash, Senator Anne Ruston, Senator Sean Edwards, Kelly Vincent MLC, Robert Brokenshire MLC, Sandra and Jeff Pearson, Liam Mackay, who was going to be a speaker tonight, Trish Miller, who established the Palliative Care Service in Mount Gambier, and I'm asked formally to read Trish Miller's apology, which I will do. It was sent to Pauline Kenny, the chairman of the Save Our Palliative Care Committee, and it reads, "Thank you for sending me the information on your sterling efforts to save your palliative care service. Please accept my apologies for the community forum on October the 7th. I'll be overseas, or I would certainly be there, because it is a truly worthy fight. Having had the privilege of establishing the service with a dedicated team of professional staff and superb volunteers, it is a very sad day indeed when a political decision is made to cut the service, nothing to do with need, and everything to do with a stunning lack of care about country folk. With heartfelt good wishes to you all for a meaningful and successful meeting which will challenge the decision makers to think again about what they are doing. Sincerely, Trish Miller." And of course that email was sent before the Minister's announcement yesterday. We've also had over 40 apologies from interested community members due to school holidays and other commitments. Before we move on, let me say that the Save Our Palliative Care Committee thought of cancelling tonight when the Minister made his stunning announcement yesterday. However, they believed that they've aroused such an interest in palliative care in the Limestone Coast that it would be a valuable forum to firstly celebrate their success and to evaluate the importance of the provision of palliative care services in our Limestone Coast community. It's an opportunity to strengthen the community to resolve on demand and receive high-quality end-of-life care. The way this will run tonight is that we'll have a number of speakers, 9 in all. We'll give you an opportunity to ask questions during the evening in 2 question sessions. So we'll have, I think, 5 speakers first, then you have an opportunity to ask questions. And we would urge you that if you don't want to stand up and ask questions, then please write them down and give them to the ladies at the side who have the microphones, and they'll bring them up and I will ask the questions for you. We urge you to send in written questions or questions via Twitter during the night, and we'll try and answer as many as possible. Please note that this evening is apparently being broadcast live on YouTube, and on Twitter feed, and you can all send comments to, and please be careful with my interpretation of this because I'm not very IT literate, but I understand it's at #SOPC. So whatever you do to get into Twitter and send your Twitter message, you've got to somewhere put in #SOPC, and we'd like to see those Twitter messages. Before we start, if I can perhaps remind everybody of the definition of palliative care as it's been adopted by the World Health Organisation. And they define palliative care as an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illnesses through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychological and spiritual. That's an all-encompassing definition, and it's a reasonable request that that kind of care be provided in a community such as the Limestone Coast. I invite the Mayor of Mount Gambier, the Honourable Mr Andrew Lee, to officially welcome you tonight. Andrew.
Thank you very much indeed, Mr. De Garis. And I welcome and thank you everyone for attending tonight. I would like to recognize the effort of the SAFE, our Palliative Care Committee, in organizing this community forum, and I should say thank you for Dr. Yvonne McMaster OAM for her attendance this evening as well. I'd like to share with you, I have prepared around 9 or 10 pages of speech, before tonight. However, after yesterday, I chucked 9 away. So I just have one single piece of paper, and I would like to make it short and easy and not that boring. As you can see from my face, I'm very happy to have learned of the Minister for Health announcement of the retention of funding for the frontline palliative care services. And I would like to commend Mr. Snelling for visiting Mount Gambier last week to meet face-to-face with us and for keeping his word and making the announcement yesterday with regards to the funding. From my conversation with the Minister, it was evident to me that he was genuinely listening to what I had to say on behalf of our community, of course, and I thank him for having the fortitude to bring about the change in the government's decision. And I believe our community's voice has been heard, and through our collective efforts, we can celebrate a positive outcome start from yesterday afternoon. And thank you.
Thank you, Andrew. It's now my pleasure to call on perhaps a less trepidatious Jane Downs to address us. Jane is the Regional Head of SE Health, and I'm sure that she would have had some trepidation addressing this group prior to yesterday. So let's call on Jane Downs and let's thank her for the work that she and her department and the Minister have done for us. Thank you, Jane.
Thank you very much for the opportunity to speak tonight. I do appreciate that. The palliative journey, the process of living and dying with a life-limiting illness, often happens behind closed doors, hidden from all but family and a few close friends. The palliative care team, those who provide professional care and support to the person and their family during that palliative journey, have gone about their special work quietly in the background, not in a high-profile way or in a public way. It's therefore quite easy to be unaware of those people who need palliative care and also of those people who provide palliative care. Palliative care is not normally front-page news. Palliative care is not normally the subject of petitions or forums. Palliative care is not often at the top of the community's wish list for new or bigger health services. It isn't high-tech, it isn't high-profile. When the South East gained new Commonwealth funds for palliative care in 2009, it barely raised a blip on the community radar. But today, we find our community in a very different place. Today we have, I believe, 10,000 people, perhaps more, who care enough about palliative care to stop and sign a petition. Today we have a theatre full of people who care enough about palliative care to take time out of their busy lives to attend a forum. Politicians, community groups, families and businesses, they're all talking about palliative care and how important it is. This community is a different and a better place from the one it was a few months ago. I want to acknowledge the role played by the Save Our Palliative Care Committee and let's call them ambassadors, as they were in that positive change, because they were instrumental. I believe that the understanding and valuing of palliative care that now exists in our community is in itself a wonderful outcome and something to be further nurtured and developed in the future. For many years, the South East has had a great palliative care service, growing from one staff member to quite a large team. Additional funding provided the South East community with one of the best regional palliative care services, a service that exceeded national benchmarks and provided comfort and support to many individuals and their families. In June of this year, when these additional Commonwealth funds were no longer available, difficult decisions were made and staff numbers were reduced. But we felt confident that the existing team-based multidisciplinary approach was sound and would enable us to continue to deliver a high-quality palliative care service in the way our community expects. Today, we welcome reinstated nursing and bereavement counselling staff back into that regional palliative care team. This has been made possible through the combined efforts of community action, local advocacy, and the Minister of Health, Jack Snelling, who listened to the community's concerns and took action to reinstate staff. The specialist palliative care service that we now have consists of, or will consist of in a moment, 2 full-time palliative care nurses, 2 part-time palliative care nurses, 1 part-time bereavement counsellor, and 4 part-time allied health professionals. So a total of 9 staff members. That's an increase of 2 full-time staff members through the reinstatement of staff. Most of these additional staff will be available immediately, and there will be a little bit of recruitment that will need to occur for some coverage of some leave, so we will commence that also immediately. So this is not a change that's going to happen sometime in the future, it's a change that is immediate. Palliative care, like many health services, is something that we want to know will be there for each of us or for our family if we need it. You can leave this forum tonight feeling confident that the South East has a strong specialist palliative care team supporting people who have complex needs, challenging symptoms, or difficult palliative care journeys. The South East also has a wealth of nurses, doctors, allied health staff and care workers in our community health services, our hospitals, our local clinics and aged care services, who also provide a palliative care approach in their everyday care of patients and residents. Our specialist palliative care team and those providing everyday care will continue to work together to provide an outstanding level of service to our community. Palliative care will be there if you or your family have a need. Thank you again for the opportunity to speak here this evening.
Thank you, Jane, and I think it is great that the professional side of administration and professional presentation of services in the South East hopefully will be strengthened with the community and with community volunteering in palliative care in the future. And I hope that we can rely on Jane to be good to her word that that strength will continue. It's now my pleasure to introduce our special guest for the evening, Dr Yvonne McMaster OAM. Before introducing Yvonne, can I remind you that there is out the front a booth where we ask you if you've got any questions that you want answered or you think may be of help to the Save Our Palliative Care Committee, please fill out your questions and pin them on the board there. They'll be very helpful to them in their future deliberations about their direction, because in a sense their campaign has finished, but I think they can see that there'll be new visions for palliative care for the future, and they'd certainly like to involve you. Also, please, those who are interested in receiving information about the future of the committee and future delivery of palliative care services in the Limestone Coast area, please fill out your names, addresses, contacts and email addresses. I think there's been forms out the front for you to fill out, and there'll be forms handed around here in the theatre tonight for you to do that. Please support this committee, because I think it can develop into a wonderful thing. Dr Yvonne McMaster OAM, McMaster, I apologise Yvonne, OAM, is based in Sydney. She's worked with dying patients for over 40 years, and cynically I said to her, but that's what doctors do. In 1974, she became one of the first palliative care doctors in Australia, that is, a specialist palliative care doctor. For 17 years after she retired, she led a support group for people with advanced cancer. She has now become a full-time advocate for improved palliative care in Australia, especially in rural areas, and is visiting all the palliative care black spots, finding out where the gaps are in palliative care throughout Australia, and particularly rural Australia, and she's trying to shame politicians and bureaucrats into filling them. Perhaps knowing that you were coming tonight, Yvonne, shamed the Minister into re-improving our services. Would you please welcome this lovely lady, Dr Yvonne McMaster.
So, what is this palliative care? Palliative means relieving. And palliative care relieves pain and other symptoms while supporting the patient and the family. Palliative care doesn't just prescribe medications. Palliative care walks beside the patient and the family from whenever symptoms start and to the last breath, and afterwards in the bereavement period. Palliative care is about living, and living as well as you possibly can to the last possible moment. And it must be available wherever people are, at home, in hospitals and palliative care units, and in nursing homes and mental hospitals, and even in prisons. Palliative care's not just about the end of life, and it's not an alternative to prolonging or curative care. There's no reason not to have symptom control at the same time as life-prolonging treatment. And being referred to palliative care doesn't mean that you're dying. It should just mean that you'll live more fully for the rest of your life. Recent studies have even shown that palliative care started earlier with some cancers can actually prolong life. It's not really surprising, is it, that you live longer when your misery is relieved? Palliative care came into being in the 1960s because of the terrible pain that patients with cancer suffered. Now, with an ageing population and people being in decline for over a longer period, with other conditions as well, the need for palliative care has outstripped supply. Palliative care is wonderful. It means so much to every life it touches. There's just not enough of it in country South Australia at the moment, though. So, how has this come about? Life has changed so much since many of us were young. Medical treatments have improved out of sight. Most people in the past just got sick and died. There wasn't much that doctors could do. People were old in their 60s. Now, the Queen is having trouble keeping up with telegrams for people who are 100. Living longer is a fact of modern life. Modern medicine is marvellous. You might remember an old movie, I always remember this one. A man falls down in the street clutching his chest. People call, "Doctor, doctor!" A doctor runs out with his little black bag, bends over the man, shakes his head. There wasn't much anyone could do. Nowadays, it's so different. Out comes the mobile phone, ring 000. You're whisked off to a bright, shiny new emergency department. The ambulance is there in a trice. They do an ECG, take some blood, put up a drip, do a CAT scan. After a while, this child in a white coat comes along. That's the doctor. It won't be long before they have a stent in one of your coronary arteries, or a pin in that broken leg, or it might be surgery for something else. But one way or another, they'll mostly have you back on the road again. A little sadder and a little wiser, and maybe a little frailer. Eventually, though, advanced disease takes hold and doesn't let go. And it can be accompanied by all sorts of suffering. Yet our governments have been too slow to recognise the growing number of unmet needs out there. So when they're a bit short of cash, they're inclined to cut funding where the sufferers are least able to complain. That's got me into advocacy, and it's why you're all here tonight. Clearly, the rural southeast looked like a soft target. And after all, it was all safe Liberal seats, wasn't it? And then it's been convenient to blame the federal government and claim that they made the cuts. We hear the same blame game in New South Wales. Palliative care is largely a state responsibility, and some states quietly recognise their responsibilities to their citizens by maintaining the funding. Health Minister Snelling obviously wasn't advised by his department about how cost-effective palliative care is. A better resourced palliative care service would save the government millions. I have calculated, extrapolating from New South Wales figures, that Country Health South Australia stands to save about $8 million annually by providing a more comprehensive community palliative care service. The New South Wales Health Department looked into what happens in New South Wales and found that in the last year of life, people spend on average 40 days in hospital in their last year, and that's an average. That costs the government $1 billion. $1 billion a year. The equivalent per head of population would see Country Health spending about $55 million a year on hospitalisations in the last year of life. Looking after people in their own homes is much more cost effective, and it's what people prefer, most people. Palliative care in Country Health needs to be enhanced, not cut. It's been underfunded for decades. It's mostly done by nurses, some of whom are specialist palliative care nurses, and very wonderful they are too. Many, however, are community nurses. There aren't enough specialist palliative care nurses anywhere in Country Health. But you'll be thinking that this isn't the right financial climate to be asking the government for more money. For people who are dying, they won't be on the electoral roll much longer, will they? So in 2013, I was asked to prepare the business case for palliative care for the then Treasurer, Mike Baird. It showed that if the New South Wales government funded palliative care adequately, that is to the tune of about an additional $40 million annually, they would save $100 million net annually. Translated to country health per head of population, that would mean a net saving of $5.5 million annually. Getting Minister Snelling to restore funds really is a terrific win for South Australia. It's been driven by people who know what a difference palliative care makes to every life it touches. But I'm hoping that this is only the start for this region. I'm going everywhere, suggesting that push for palliative groups form in rural towns. We now have 3 such groups in rural New South Wales. They focus on local issues, advocate to governments for more resources, and some are now raising funds to supplement what palliative care services can offer. I'm wondering if something similar might be possible here. It could be a safeguard against any backsliding by the government. It could point out, through the media, where the gaps are, and it could inspire other groups across country health, where the palliative care services are paper thin, to help their palliative care in those areas. It really is time for the whole community to shout out to government and the bureaucrats about this, because in the end, it's about time. Time to share in the comfort and company of loved ones. Time to die with dignity and care. And yet time to be truly alive for the last possible time. Because palliative care patients aren't dying, they're living. And while they're living, their experiences of palliation, and as they die, their families' memories and recollections of that, all converge upon a similar truth, that palliative care is wonderful, but I'm afraid there's just not enough of it in South Australia at the moment. Thank you.
Thank you very much, Yvonne, for those thought-provoking thoughts that you've left us with tonight. You've left us with some challenges. Those challenges are to convince the government that spending more, they're going to save more. Yvonne, you can run that case. You might have some problems, but I think it's very well worth putting the argument up. Secondly, that the challenge is to keep this group going and to keep being an advocacy group for palliative care. I think that that's important, and I think at the end of the night that everybody here will support the Save Our Palliative Care Committee to keep going and to keep advocating for better palliative care services in the Limestone Coast. So once again, could you please thank Yvonne for her very thought-provoking talk tonight. Ladies and gentlemen, the committee has put in a great deal of time and effort to get the results that it has achieved. It has spent most of its own money to put the flyers together, to get the petition together, to put tonight together. And we would really like it if you could get all your small change before you go and stick it in the boxes that are outside. This would greatly help defray the costs of the work that they've done. They've asked me to say to you that if there is any change over and above, any monies left over and above their expenses that they've incurred, They will put that money towards a new group, a palliative care group, if it is formed to further advocate for palliative care. And if that group doesn't eventuate, then they'll donate the extra funds to a local charity, which they haven't yet nominated, but they will donate it to charity. So please be generous in supporting them. I know they've spent a lot of their own money in getting this result for the community, so please don't walk past those boxes. It's now time to share a personal story, and I'd like Margie Carruthers, if she'd please come up. Margie, with her husband Ian, benefited from the palliative care team, both in the hospital and at home, and she's got a story to tell. Please welcome Margie Carruthers.
Thank you. I'm only a tad nervous, so please bear with me. I haven't changed what I wrote since our good news yesterday, so I'm just going to read it. When Maria phoned me and asked me if I would speak at this forum, my answer was yes. I'm passionate about the wonderful care they gave my late husband Ian when he became sick. In 2007, after 2 years of having medical treatment, we were told the cancer had spread to his bones, and if lucky, we had 3 years. That was the beginning of a journey with the palliative team. Ian had decided he wanted to pass away at home, if possible. So as time went by and there were more hospital stays and treatment, the palliative team was swung into action. They got us to face things that we all don't wish to face. Updating wills, talking about funerals, seeing if Ian wanted to write letters to family. I've yet to find them. Many forms over the years they helped us sort out. They dotted the I's and crossed the T's because our lives had been turned upside down. We were blessed. Ian was with us for 6.5 years. He was positive and he never gave up. But as time went by, the equipment crew from the hospital came in to our home and set up electric hospital beds, air mattress, shower rails, recliner chairs, ramps, many things to make his life comfortable. They taught me how to use the lifting sling when he could not walk anymore. July 2013 saw Ian in hospital for 5 weeks, growing weaker every day. It was time to bring him home. The palliative nurses set up his medical pumps and extra pain injections, and as that was the only thing I could not bring myself to do in case I hurt him, they put a butterfly in. Home care started their call-outs too. They would come every second day, washing, shaving, changing his pyjamas. They also did a few chores for me. Jane and Jean also came out on regular basis. They were volunteers. They helped massage Ian's hands and feet, and sometimes I was lucky to get it too. This was all arranged by Palliative Care. Ian had been home for about 2 weeks when Liz Fallis, our clinical nurse, or palliative nurse, made her daily visit to check his obs and reset the pumps. It was Tuesday, the 20th of August, and he could fight no more, passing away while she was there. Liz phoned our doctor, who came straight out. I guess she contacted her office too and told them she'd be a little bit longer than usual. And after giving us some time, she removed all his lines and made him look comfortable. I think she even called out later that afternoon to see us. Bringing Ian home gave him the comfort of familiar smells and surroundings. His dog Maddie sitting by the window, and not the clinical hospital rooms that he'd been in so often, and just time for us. by cutting this very special team puts stress on those who have chosen a difficult job, watching and tending patients who have limited time, and whilst supporting their family members. In closing, I wish to thank the palliative team for taking great care of my Ian, and I thank you all for coming and to supporting this very special issue. Thank you.
It's a salient reminder that we're all, if we haven't already been through this process, we're all going to go through it, either as supporters or as sufferers. So it's good to hear those personal stories. Now I'd ask that you welcome Stephen Wade, MLC, Shadow Minister for Health for South Australia, and he will give us a perspective on funding. Thank you, Stephen.
Thanks, Bill, and I'd like to acknowledge my parliamentary colleagues, Troy Bell, Mitch Williams and Tony Passon, your local mayors, the Save Our Palliative Care Committee, ladies and gentlemen. Today I'm delighted to be with you to celebrate with your community the winning back of some key palliative care services that have been terminated. I acknowledge the hard work of Pauline Kenny and her team and of your local parliamentarians. I'd also pause to thank the Mount Gambier community for the very strong support you gave to saving the Flinders Medical Centre neonatal intensive care unit. I believe that was instrumental in that success as well. But in relation to palliative care, I want to suggest to you that this is only the end of one battle. Today should be the start of a discussion with the state government on palliative care services in the South East. Providing quality, accessible palliative care is a core responsibility of a public health service. That's why 6 years ago the state government published a plan for palliative care in South Australia. In July 2009, Labor Health Minister John Hill released the Palliative Care Services Plan 2009 to 2016. A key element of the plan was to, and I quote, increase the palliative care capacity of country general hospitals, end of quote, in South Australia. Mount Gambier and 3 other country hospitals were identified as hospitals which would be upgraded to what is called a Level 4 palliative care service. In 2013, the Independent Health Performance Council reviewed the progress on the plan. It reported that staff were concerned that their services would lose ongoing funding. The council found that the government had been reducing the number of palliative care nurses in South Australia since 2007, and that staffing in 2013 was below the targets set out in the 2009 plan. The federal Liberal government was elected in 2013. When short-term Commonwealth funding ended, the state government took the opportunity to blame the federal government for withdrawal of funding what is a state government service. The government did continue to fund palliative care for children, but withdrew other services, including palliative care services in the South East. In November 2014, the state government launched a program aimed at engaging general practitioners in palliative care, but it was only available to GPs in metropolitan Adelaide. These facts highlight 2 things. First, that the government can find money when it wants to. Over recent months, they found $3 million for a public relations campaign on their metropolitan health plan. But when they needed to find $400,000 to secure the funding for palliative care, it was not a priority. They didn't find the money until your community launched your campaign. Secondly, I believe that the history shows that the regions are a low priority for the government. It's good that they've restored 2 FTEs, but they have failed to I think we need to be sure that the support that those FTEs need in terms of administrative and other support will be available for them to do their job. But also I'd encourage the community in the South East to hold the government accountable to deliver the upgrades to palliative care in the southeast that the government themselves promised in the 2009-2016 Palliative Care Services Plan. Even though there are less palliative care services in the country, the government is giving priority to implementation in metropolitan Adelaide. In implementing the plan, the upgrades of level 6 services in the city is significantly more advanced than the upgrades of level 4 in the country. I commend your commitment as a community and congratulate you for gathering over 10,000 signatures on the petition. I encourage you to keep fighting to ensure fair access to health services in your region. Thanks for coming tonight.
Thank you very much, Stephen. It's staggering, isn't it? 10,000 signatures. That's 1 in 6 men, women and children in the Limestone Coast area that signed that petition. It's absolutely wonderful. It's a grassroots democracy really in action. Now we'll take a little break for some questions. I think we've got microphones out here, over here, and please direct your questions to the 5 speakers that we have on stage, please. Anyone that has a question, first up. I can't believe this. A public forum in Mount Gambier and nobody's speaking. Up the back there, thank you very much.
Through the chair, Bill, it's Bob Sando, President of the RSL. To Jane, if possible. Jane, you said we had the best system, the best benchmark system that was available, and I just wonder why we had to gut it. Why didn't we learn from it?
I'm sorry, I was interrupted there, Bob, but who wants to pick up that question here? Jane?
Thanks, Bob. It is an excellent service. It was and still will be. It's not an easy decision to try to juggle the resources across all of our different health services and the needs that they represent. I can only say how grateful I am that the funding that we have received back to reinstate additional staff will bolster those services and continue the excellence that it provides every day, as we heard this, with our last speaker. Thank you.
Thanks, Jane. Pauline. No, I've got a question here in the middle of the gallery. If you do have a question, perhaps make your way out to the aisles where the microphones are. It'll make things easier. Thank you.
I'd like to address this to our honourable opposition spokesman on health. I know we're talking about palliative care here, but I see this as just another, I would say, the thin edge of the wedge, but it's more than the thin edge of the wedge. I am a recently retired GP who's been here in Mount Gambier for 30 years, and during that time I've just seen decreasing services offered to regional health services of any sort, and not only health services, but as I think you alluded to, the current government just couldn't care less about the regional areas at all. And if Adelaide, or if South Australia finished at the outskirts of Adelaide, that would make them very happy. And I see this promise of reintroducing some of those palliative care services, but it's only a promise. I want to see some actual action on it, and some of the other incursions on our health services that have occurred recently. The treatment of Mr McCusker and Mr Forbes, our local orthopaedic surgeons, of Dr Hodson and his associates, our local ophthalmologists. We go back to the treatment of the general service surgeons, Mr Landy, Mr Strickland, many years ago. The treatment of obstetrics, GP obstetricians some 15 years ago. It's been a continuing decline in the facilitation of services in this region.
So the question is basically that the decline in funding for country health, you want Steve and Wade to comment on?
Yes.
Okay, thank you.
Yeah, thanks for the question, Dr. Gale. We're in the middle of discussions in our Rural Affairs Committee, and both Troy and Mitch are active in that, about what commitments we're going to make to the people of country South Australia at the next election. We made some very clear commitments when we were last in government about the maintenance of country health services, which I believe were vital for the reconfiguration of many of those services. But it was in that period that we had I think it'd be fair to say that that's when we started to introduce aged care services, which have ended up being vital to the viability of a number of country hospitals. So I assure you that that when I sit in the party room and about half of the members are rural members, I'm very aware that the Liberal Party has every intention of honouring its tradition of supporting country people through quality health services. One of the key planks that we've already committed to, and which we intend to reaffirm, is decentralisation. Decentralisation, particularly of the control of health services. We believe in the reintroduction of hospital boards at the regional, particularly at the regional level, and also the re-empowerment of local hacks, or whatever they might be called. We believe if local communities raise local funds for local health services, they have the right to control them. I totally agree with you in relation to medical staff, and I'll be taking the opportunity while I'm down in the southeast to go to Narracourt and speak to people there about the situation with the King Craig Medical Clinic. I think one thing that people often forget is that when your medical staff are fighting for contracts, they're often fighting for your services. For example, the King Craig Medical Clinic, one of their key demands was to have a fourth doctor available in an obstetric situation. So I think it's very important that no matter what part of the health services we're talking about, the communities are strong, and I think the campaign that the Mount Gambier community has raised on palliative care is a good warning to governments of any colour that this community cares. I'm sure that the 10,000 people who signed that petition, many of them would never have been touched by palliative care services, but they care about their community, they care about their health care. I commend you for that, and I assure you that I've had one session with the rural committee about our commitments going forward, and we're meeting again shortly. So it's front of mind in our party room.
Thanks for that response, Steve. We'll keep the rest of your questions for later on, so there'll be another session a little bit later for you, an opportunity to ask questions, so please jot down those queries so we can put it to our panel. I'd like to welcome Dr Mike Broughton, GP at Hawkins Clinic here in Mount Gambier, and I'd like Mike to give us a perspective of palliative care from the GP's angle. Thank you very much, Mike.
Good evening. Well, I was asked to talk about the cuts to the palliative care team from a GP perspective. We've heard some wonderful things already from our speakers about palliative care, and probably in the light of the last 24 hours, I could have changed my talk completely as well. I just felt that the talk I had written was coming from a GP perspective and just basically setting out how important palliative care is to us as doctors, and I thought I'd keep the talk as it was. As healthcare professionals, we were overwhelmed and humbled by the public response to the cuts in our palliative care team. My own feelings when informed of the cuts went from shock and dismay to disbelief and then anger. I couldn't believe that such an important component of healthcare and provision could be denied to our community. From a GP perspective, we expect to care and manage illness and medical conditions through a patient's life. Not being able to provide for them and their families through the most vulnerable and difficult time of their lives seemed inconceivable to me. I've had the privilege to work closely with our palliative care team on a number of occasions. As a result of this, I have felt confident to discuss the dying process with terminally ill patients and their families, knowing that I could offer them the option of care at home under an excellent and dedicated palliative care team and with a known GP in support. On a number of occasions, family members have expressed their gratitude that this service was offered and then accepted, when there had initially been some concern about taking on the task of caring for a dying relative at home. One only has to look at the large number of letters expressing this similar sentiment from many families to appreciate what sort of service has been provided to so many and how much this has been appreciated. To feel that I could no longer confidently offer patients and families the same level of service was deeply distressing. So why is an effective palliative care team so important? And why would cuts affect us all? Well, most of us would like to provide a dying relative their last wishes. And for many, that means dying in the security of their own homes and with their families present. But caring for terminally ill relatives at home may be the most difficult time a family will face. And managing the last stages of life is challenging. Challenging for family members, challenging for the patient, and challenging for their GP as well. Challenging for numerous reasons. Simply the sheer practicality of it. One needs appropriate equipment, beds, hygiene-related aids, prevention of pressure sores, medication needs and medication administration, counselling about all of these factors, and expertise in providing this. The dying process is also a dynamic process. In the terminal stages of life, we experience changes in physical condition, changes in breathing patterns, changes in mental status, changes in pain levels. All of these are very challenging, and this is where the palliative care team comes into its own. After we refer a patient to their service, our effective and dedicated team just takes the case and runs with it, arranging the necessary equipment and arranging a home environment that's suitable for a terminally ill patient. Initial and then regular meetings with families assist in leading them through all these challenges, and I knew that without this support, I would not be able to offer patients this service. But what makes our palliative care team so special? Well, like our beleaguered orthopaedic surgeons, this is a team of local, resident health professionals with a commitment and an investment in our community. We've seen this team grow into a functional, highly effective, much loved and much respected service. Just as an example, in addition to other cuts, Melissa Norman was cut completely from this team and hopefully now reinstated. I've worked with Melissa on a number of occasions, and recently we cared for a wonderful man and friend of mine who was dying at home. After he died, his wife told me how their family referred to Melissa as their angel, and how she was always available and willing to answer their myriad of questions and deal with all their concerns. How can you put a monetary value to this sort of service? How can some bureaucrat suggest that our community does not deserve this kind of service? All of us, all of you, have different doctors and different healthcare providers. This town and region, however, has only one palliative care team. We simply could not afford to see this service reduced. This community deserves better than that. Thank you.
It's hard to escape that kind of passion, isn't it? Professionals who live and work in the region, provide services in the region, we need to tell everyone, especially our political masters, that we really do value them. Could you please now welcome Jenny McRae, who wants to share a personal experience with the palliative care team. So Jenny, would you like to come forward?
Tonight, I just want to share Bruce and I's journey. Our story begins at the Melbourne Private Hospital, and Bruce has just endured a gruelling nerve conduction test. It is February the 14th, Valentine's Day. Valentine's Day is supposed to be about romance, red roses and chocolate. Not hearing that your husband has a wasting disease of the muscles, will not be able to work, will be in a wheelchair, and end up relying on you to do everything for him. We had just been told Bruce had motor neuron disease. You cannot imagine hearing these words about someone you love so dearly. You are instantly gripped with fear and shock. Fear for your loved one, fear for yourself, fear of dying, fear of the future and what it holds, and wondering how you are ever going to cope. I have never felt so alone and isolated in my life that day in the hospital. No counsellor, no social worker, no pamphlets for you to learn about this disease and what was available. You find that you are no longer walking, you're no longer in the norm or mainstream like everyone else around you. You are suddenly walking a very different and unfamiliar path. Motor neuron disease is terminal. There is no cure, and each day is not as good as the last. Some of you will be familiar with the ex-Melbourne coach and Essendon football player Neil Danaher, who is currently battling this disease and helping to educate Australians with MND. I shall never forget the day Rebecca and Kathy knocked on our door. To have someone come and say, "You are not alone, we will be there to help you every step of the way," are the most reassuring, comforting words to hear in such a stressful, vulnerable and emotional time in your life. Without the palliative team care guiding us through the maze of services, forms and equipment, specialist visitors and medication, which was needed on this journey, I do not know how we would have coped. When you find yourself in this situation, you just crave normality. Having the palliative team here in Mount Gambier enabled us to live in our own environment with family, friendship groups, and allowed me to stay in the workforce. It is hard enough without the added burdens of financial, emotional, physical and mental pain of moving away from all that is familiar and dear to you. I cannot speak too highly of the dedicated support team who surrounded us at this time. The empathy shown, their ability to problem solve when each new challenge presented, and there were many. Bruce was a strong man and loved working with his hands, either doing renovations, additions, tinkering in his shed, or working on his little farm. This disease is cruel. It takes away what you are good at and you enjoy. With the help of the team, we were able to give Bruce the best quality of life that was possible and plan and prepare for a peaceful passing. The palliative team were the glue that stopped us from shattering. Their knowledge base and strength as a team is outstanding, and these skills are not to be lost from our community. If you ask me what the palliative team meant to Bruce and I, this is how I describe it. Imagine yourself out at sea. You are in the water. It is cold, dark, and you are alone. Waves are crashing all over you and around you. Just when you think you cannot hang on any longer, someone throws you a life buoy. You hold up your hands and you feel that life buoy wrapping around you and supporting you, preventing you from going under. This is what palliative care meant to us. One day you might find yourself needing that lifebuoy. Bruce died 18 months after being diagnosed. Along the way, we had ticked off many places we wanted to see on his bucket list. We threw an oh fuck party when he was diagnosed, and this broke the ice for family, friends and workmates. He heard how much he was loved and what we achieved together that night. He also had a living wake under the tents of a birthday, and he also saw his PowerPoint presentation. We were doing one last trip on his bucket list, a trip to Brisbane. He experienced respiratory distress and was admitted to hospital. His advanced care plan was enacted when he lost consciousness, and he died peacefully and with his wishes respected. This brought my family a lot of comfort, knowing it was done his way and it was his time and he was ready. I will be forever indebted to the palliative team care, working at the front line, never knowing what to expect when you open your door to receive them. And this is why I am speaking out tonight, fighting for all those who find themselves with a terminal disease and for their loved ones who will need so much help at this time when their world has suddenly shattered and comes tumbling down around them. No one should walk that journey alone and without help. Shame on this government, shame.
As Jenny says, one day you might need the lifeline that a professional palliative care team can deliver. Let's hope people like you, Jenny, sharing your stories will strengthen the palliative care service in the Limestone Coast and make us not forget that we really do need that service. Thank you very much once again. I now call on Member for McKillop, Mitch Williams MP, to address us for a short time. Thanks, Mitch.
Thank you, Bill. Thank you, ladies and gentlemen. Ladies and gentlemen, I haven't come here to talk about palliative care, but to talk about a culture. A culture which has seen less than adequate and declining health services in country South Australia. Bill, I think I wrote it down correctly when you read the apology from Trish Miller. I think she said, a stunning lack of care for country folk. That's what we've seen. It pervades across not just our health services, but a lot of other services. But I'll just mention a couple of declines that I've experienced in next door to here in my electorate. You're probably all aware of what happened at the Keith Hospital a few years ago. You may think that that situation was resolved and is over and finished. The reality is that a 3-year funding agreement was written with the Keith Hospital Board. That expires on June 30th next. My information is that the government are not of a mind to extend that further. So we might see that battle restart all over again. Just up the road at Millicent, we've seen the withdrawal of obstetric services from the local hospital. I have grave concerns that that might see a spiralling decline in health services in that community, because at Millicent we've never had significant problems in attracting and retaining GPs, particularly with specialist skills. They will no longer be attracted to Millicent if those skills happen to be in the area of obstetrics and maybe even in the area of anaesthetics. We've just seen in recent weeks a dispute with the doctors at Narracourt and an agreement for their ongoing services delivery in that community. One of the startling things that came out of that dispute has now been revealed, that the level of service provided in country South Australia is less than it is in metropolitan South Australia if you happen to be undergoing an emergency caesarean section. Why are country people treated differently to people in the city? That's the question I think we've been asking ourselves for some time. I'm not going to thank Jack Snelling for his announcement yesterday. The reality is that Jack Snelling should have never presided over the cut to the services in this community. Can I just say to you, there will be many more battles. Dr. Gale, I thought, was going to steal all of my thunder. There will be many more battles. But can I, in concluding, just congratulate Pauline Kennedy, her committee, the Save Our Palliative Care Committee, and every one of those 10,000 people from this region who signed the petition. Thank you very much.
Thank you very much, Mitch. I've been asked by the committee to read 2 or 3 submissions that have been made to them this evening. The first is a personal statement from Carol Smith. Carol's husband died of a melanoma at the age of 44, just over 25 years ago. They had 3 small children at the time, aged 5, 8 and 10. These are Carol's words. I could not have survived without the help of the palliative care team, as their care and advice was invaluable. She remembered Trish Miller, who headed up the group. I would not have been able to keep the family going without this help. The ladies came each day to assist my husband with morphine injections, and then he had a shunt put in which they monitored. Carol said she had no doubt that her husband would have had to go to hospital without their assistance, and neither she nor her husband wanted that to happen. Carol explained that it was a horrible cancer, and even after 25 years she remembers it so clearly. Impossible to have survived the ordeal, especially with 3 little children, without support. She does not want anyone else to go through something like this without the help and support that she received. The team's attention to medical detail was excellent, but also their advice on various matters that she would not have had any idea about, e.g. calling his local doctor, not the ambulance, as they are obliged to ring the police. She felt she could not have coped with that at the time. She asked the politicians to try and understand what these circumstances are like, even if they have never had to confront these issues personally. And that echoes the other personal stories that we've heard tonight. I've also been asked to read out a statement from Gavin Molden. It's a letter directed to Jack Snelling. Dear Mr. Snelling, does this cut relate to lowering of palliative care standards? One would assume so because of the staffing numbers being cut back. You tell us now there are 15 more palliative care beds being made available in the future at Flinders Hospital in Adelaide. Does that mean when palliative care in Mount Gambier has not been sufficient in caring for the terminally ill patient? Does that mean the patient will be sent to Adelaide for specialist treatment of palliative care? If this is so, is the government going to accommodate the families of the terminally ill patient? If palliative care has failed to improve and provide a better quality of life for the patient, I think that you should pass a law to allow the patient to choose to terminate their own life, legalise euthanasia, when other forms of care have failed to ease the pain and suffering of the terminally ill. Regards, Gavin Molden. The third is just simply Michael's story. I'd like to tell the people here tonight an incident that happened to our family earlier this year. Michael was diagnosed with a brain tumour in February here at the Mount Gambier Hospital. He was flown to Flinders Medical Centre where he undertook further tests, 2 MRIs, a needle biopsy and an open biopsy. He also received 24-hour care where a nurse was with him the whole time. As no treatment was going to cure Michael, we asked if he could be flown back to Mount Gambier Hospital on the understanding that he'd be given the same care that he received at Flinders. Michael was flown back to Mount Gambier on the Saturday, and by Tuesday afternoon he had passed away. We feel that Michael didn't get the care he should have, and we were told afterwards that palliative care didn't exist at Mount Gambier Hospital on the weekends. This is hard to believe. Why have palliative care if it isn't viable on the weekends? There should be enough palliative care nurses to be on a roster system which includes the weekends. We strongly vote for palliative care to be reinstated at the Mount Gambier Hospital. People who are in the last stages of their life need the compassion and support of the palliative team as well as family members. At no stage were we told that Michael was nearing the end. If we had known this, family members would have worked on a roster system to be there by his side when he passed away. Instead, a family member walked into the room and found Michael had passed away alone. Pauline, we send this to you to read out at the forum. Kind regards, Joe and John O'Brien. And the last statement I've been asked to read comes from Kelly Vincent, MLC, for the Dignity for Disability Party. Kelly says, like you, Dignity for Disability is deeply concerned about cuts to palliative care services in the southeast. We're anxious that removing supports for in-home palliative care will increase reliance on our already overstretched hospital system and take away the option to face the end of life in a familiar setting surrounded by family, something which I understand can bring significant comfort at a time of great fear and uncertainty. This is particularly important, I believe, in smaller, tight-knit communities where access to health service is already complicated by geographical barriers. This is why we've started a petition on change.org, that's for technical Neanderthals like me, that it's got change, then a dot, then org, to ask Minister Jack Snelling to explain the reasoning behind his cuts and ensure that alternative supports will be available for people facing the end of life and their loved ones. We have also asked questions in Parliament about these cuts, but have yet to receive a response. The text of my questions in Parliament and the link to my petition are available on my website or Facebook page, whatever that is. Thank you for your continued advocacy for local palliative care. Your work reminds me of the famous quote by Margaret Mead, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." Please maintain your campaign of opposition to these cuts, and I will do what I can to support you. I'm very sorry I cannot be with you in person, but I send my very best wishes for a successful event. Kelly Vincent, Dignity for Disability, MLC, September 2015. Our final speaker this evening is Tracy Waters. Tracy is the CEO of Palliative Care SA and has been in that position for 6 years, 2009 to 2015. Tracy has previous experience, some 13 years, as the CEO of a home-based community palliative care service in New Zealand, which she ran from 1995 to 2009. Now, I want you to listen to this figure and don't misinterpret what I say, but she's very proud of the fact that the organisation achieved an 85% home death rate, and that means that, of course, their patients died at home with palliative care services at home. Would you please welcome Tracy?
Thank you very much for inviting me to come down to Mount Gambier and join your Push for Palliative Care campaign. It is indeed a privilege to be invited to speak here this evening. And I want to thank you all for coming along. Talking about end-of-life care and issues is not an easy thing to do, but at a recent conference that we held in Adelaide, a palliative care conference, Professor Maren Gott, who is an English woman actually, but based in New Zealand, decreed that we do need to start a public conversation about end-of-life care, because if we do not, if it is not the people that actually drives this, end-of-life care will simply become submerged under the weight of the technocentric inpatient services. palliative and end-of-life care needs to be as special as all of the acute curative services that are currently being offered. We can't let it slip behind in that regard. Woody Allen reminded us that as a society we do like to keep death out of sight and out of mind, and that conversations about death and dying are generally taboo. But I'm here to change that. I'm from Palliative Care South Australia, South Australia's peak body for palliative care, and it's our belief that how we support our dying citizens and the process of dying, either for our loved ones or for ourselves, is a universal concern. Hence the need to start this public conversation, and you have done it so well down here in Mount Gambier to date. Our work is about promoting death literacy, in other words, building resilience and well-being in response to end-of-life issues, and we do this by speaking out at events such as this, to raise awareness not only about palliative care but about its philosophy, and by bringing people together to discuss its values, its principles and its development, and it's those that we need to think about going forward. Palliative Care SA is a not-for-profit membership organisation, and it's through the collective voice of members, people just like you, that we try to ensure palliative care remains available, remains top of mind, remains right in the middle of the funding decision makers, so that it cannot fall off their radar. People may be dying, yes, but care at that end of life is really important. And we've heard about why it is this evening. So I've really come tonight to listen to exactly the conversations that you've been having tonight, so that we can try and build on what's needed going forward in the future. I have brought with me this Palliative Care Services plan. It is a real live document, and it does say that it goes through to 2016. So the Minister, Jack Snelling, has reinstated palliative care nursing services. I'd suggest that's achieving the minimum. This document here actually decreed that by 2016 things would be very different. I don't think they are very different at the moment. Australia has a national palliative care strategy. It has 13 national standards to ensure high quality care, and the provision of palliative care is increasingly becoming the exception rather than the norm for the majority, and there are still significant issues and challenges that need to be addressed in terms of expectations, in terms of service reach and access, and I think we're hearing that very loudly about rural South Australia, and about the varying quality. If you're going to call it palliative care, it's got to meet palliative care standards. There's no two ways about that. Eileen Goodman, another, I think, feminist, said in the Harvard Business Review that if we want to tackle a problem that affects all of us, we have to think big. So I suggest that if we want to transform health, which is the new jargon in Adelaide, then I suggest we have to change the way we die. Only then will we release funding to be able to spend in the right areas of healthcare. 70 to 75% of people express a desire to be cared for and die at home, yet most will die in hospitals, residential aged care facilities. Quality palliative care is a systematic approach to dying and death care that meets individually expressed desires to die at home. So I want to know, what are the factors that influence your access and your choice to die at home here in Mount Gambier? We do know that funding is a key lever. We know that nothing comes for nothing. We know that it's a key lever, and that significant cost savings and outcome benefits are possible with large-scale, coordinated community palliative care. But we also know that palliative care funding in country South Australia is not currently supportive of robust community models. And I guess I want to ask if funding, and that's directed at Jane and obviously Country Health SA, can we approach funding of palliative care services in a different way so that we can reap benefits for citizens and for the people for whom we've heard the stories of tonight? Knowing the reorientations people face long before they need terminal care, people should be able to obtain palliative care services freely long before imminent death, whereby the choice not to continue seeking curative treatments is progressively achieved through the application of holistic principles of palliative care and the concepts of seeking relief, comfort and support. We've heard tonight that you have got a fabulous nurse-led palliative care team, and I do want to congratulate them for the work that is obviously going on down here, because there are some good news stories. Is that care available to everybody? Are there hoops or flaming eligibility criteria that you need to meet? Is it a simple process? There is some butcher's papers and some post-it notes out the front and some questions to prompt your thinking. If palliative care is going to improve, we need to know what it is that you as a community expect, what you need at the end of life. It has to be your needs that are expressed, and through engagement in processes like this, and hopefully ongoing with Country Health SA, they will take into account consumers' needs rather than prescribing for them what they feel they might need. Thanks again for letting me speak tonight. I hope that the outcomes of this forum sees specialist palliative care available to absolutely everybody in need when they need it. This document will be out the front as well for you.
Well, I thought yesterday with Jack Selling's announcement that it was all over, it was all finished and all paid for. We've heard speakers tonight say that's just not the case. We need more funding. We don't just need the funding that's been reinstated. That's just a start. Now, the next part of our program, I'm going to invite the 5 members of the Palliative Care Committee that got this thing rolling to come up on stage. Now, these people, by their own efforts, gathered 10,000, I'll talk while you come up, Pauline. So Pauline, Marie, Maxine and Mary and Marius, please come up on the stage. You know how to get here. These 5 guys, by their own initiative, were shocked by the announcement of the cuts in palliative care, and they went around the region, and with a lot of helpers and a lot of help, they have gathered 10,000 signatures. 10,000 signatures to reinstate palliative care in the southeast. That's just an amazing affirmation of what grassroots democracy can do, and it's exactly what Kelly Vincent said when she quoted Margaret Mead, that small people doing small things can snowball into large things, and they've had an absolutely amazing result by gathering those signatures. And one might think that tonight is an anticlimax and that the next part of our ceremony may be described as an anticlimax, because I'm going to ask that the committee formally present that petition to MP Troy Bell, which of course they were always going to do. It's not an anticlimax at all. It should be reviewed as a symbolic gesture by the committee to say, this is the work we've done, this is the result we've got, and we hope that things will be better in the future as well. We're going to keep working, we're going to keep driving for better palliative care services in the Limestone Coast. Could you please congratulate them by welcoming to the stage. It's now my pleasure to welcome Troy Bell here to wrap up today, and Troy's promised me he will not allow this to go over the time that we've agreed. So would you please welcome our local MP, Troy Bell.
Thank you, Bill. And for those that were wondering, that's what 10,000 signatures looks like. So I'll be presenting that in due course. But to wrap up tonight, I mean, you know, a lot of people have good intentions, a lot of people have good thoughts, but it takes a very special kind of person to put those thoughts into action. And Margaret Mead's Fantastic Five, as I've now anointed them have certainly done that. They've put thought into action and been relentless in that pursuit. I mean, to the point where Pauline has a chair in my office because she's in every day, and we'll miss your visits, Pauline, but they may continue in a different way. But tonight has come together, in a fantastic way. It takes a lot to put a night like tonight together, and I'd just like to thank the speakers, particularly those who have travelled. I think there's been some very powerful and emotional stories here tonight, and I really appreciate those. I was very touched during those, so thank you very much for coming along, particularly all those that have travelled. I really do appreciate it. Of course, all of this can't happen unless you've got a media or a forum to get that out. And I'd have to say the Border Watch has shown that it is a community newspaper. And, one way we could show our appreciation is tomorrow, make sure you go out and buy the Border Watch. If you can, buy 2, because it is a fantastic community-based newspaper, and you do need a medium to get your stories out. And we've seen with the loss of our TV news service that print media is really important to our community. So I'm so grateful to the Border Watch, Sandra Morello, Jason Wallace. Their support of this has been fantastic. And if you add up the print space that's been taken up there, it's tens of thousands of dollars worth. So fantastic effort from the Border Watch, and really do appreciate it. And I should have mentioned the podcast as well. I mean, it was one of those things where we were deciding whether to go forward with tonight or not. And I'll be honest, I was probably leaning in the not camp, but I'm so grateful we did. And the push by the Fantastic Five, because it really touches home. And this has been recorded, so I'll be asking in Parliament that whether Jack Snelling has viewed the forum, and demanding that at least he's paid attention to the information that's come out tonight. So we'll be nominating for an award, I'm sure, on the Innovation Media front at the next awards, which will be great to see. Of course, ABC Radio, always taking stories. Star FM, fantastic effort to keep the public and our community informed. And last but not least, on the official thank yous, Bill DeGarris, who is running, a very successful business, and at the drop of a hat, yes, I'll MC. We've had meetings before this, of course, so thank you, Bill, for all your work. The City of Mount Gambier, which has been fantastic in their sponsorship, but to all businesses, those who put stickers on their windows, those who allowed the petitions to be in your shops and in your community foyers and all the rest of it, fantastic. But of course, the biggest thanks goes to you here tonight and those who have signed the petition, because like I've said before, I can fire the bullets, but in Parliament, but I really need somebody loading them in the gun for me. So thank you very much. Appreciate your attendance, and well done.
We have a hand up in the back. Do you want to ask a question? Thank you.
Thank you for the opportunity to speak. I asked Pauline Kenny earlier today whether I could make a comment. I hadn't intended to make the comment, but anyone who knows me knows that's very hard to believe. Well, with this excellent outcome, I just couldn't remain silent. And firstly, I must commend the ambassadors of the Save Our Palliative Care campaign, which you've just acknowledged. In addition, our member of Mount Gambier, Troy Bell, Mayor Andrew Lee, the Border Watch, other media, they've soundly supported the famous five with their efforts, along with the various organisations, so thanks to all concerned. Our community is generous and caring, and we recognise that the original decision by the Health Minister was unjust and lacking in compassion. Simply because of the forest sale issue, I believe that initially there would have been scepticism and doubt that we, the community, could bring about any change. However, through the dedication and determination of a band of campaigners, the community commitment slowly built. Thank goodness it did. Consequently, everyone who signed the petition contributed in a significant way and therefore helped to achieve this excellent outcome. What really impressed me was the respectful, dignified manner in which the ambassadors conducted themselves and organised the campaign, and they deserve another round of applause. Our community has managed this reversal of fortune through the perseverance and foresight of this handful of quiet achievers. The people of this regional community have proven that people power can be a quietly persuasive force and can make a difference. Well done and thanks.
Thank you very much for your comments. You've taken the wind completely out of my sails. I hope that everybody here has come along to learn and has learnt plenty by coming here tonight. I've learnt one thing, and that is that we do have a quality service for palliative care in this region, and we can't afford to lose it. I hope it's served your needs for information as well, and I hope that you all take up the challenge to make sure that there is an advocacy group for palliative care services in the southeast, and that this is a first significant step in preserving this service and increasing the services for the future. And all that credit is to go to the 5-member committee, but I think a good deal of credit should also go to Troy Bell for the way in which he has conducted himself with this, the way he's negotiated with the Minister, and the way he's achieved at least this outcome. And thank you all. You scratch my back, Troy. And finally, ladies and gentlemen, thank you all for coming tonight, and thank you for participating in this forum. Thank you very much for coming. Good night.